Imagine walking into your barn, and there it is, a cow that's unable to get up, struggling in a vulnerable state. This is a scenario no farmer wants to face, yet it happens more often than we'd like. Downer cows, or cattle that are unable to rise, can be a distressing sight and a real challenge to manage. However, understanding the causes, diagnosing the condition accurately, and providing the right treatment can make all the difference in their recovery. In this guide, we'll walk you through how to identify downer cows, explore the underlying causes, and share the best practices for treatment and prevention to get your cows back on their feet. A downer cow can be caused by a variety of factors, ranging from metabolic disorders to physical trauma. Identifying the cause quickly is crucial for effective treatment. Metabolic disorders include milk fever, which is a common issue that arises post-calving when cows' calcium levels drop dramatically, leading to muscle weakness and, in severe cases, complete recumbency. Immediate calcium treatment can often bring a cow back to its feet. Grass tetany, or low magnesium levels, can be fatal, but early intervention with magnesium supplements helps prevent the worst. Phosphorus deficiency can leave cows weak and unsteady on their feet, impacting their mobility. Sometimes, the cause of a cow's inability to stand is an injury, perhaps a fracture during calving or a sudden fall. These injuries often require veterinary intervention and sometimes surgery. Diseases like mastitis, metritis, or peritonitis can cause fever, weakness, and muscle wasting, contributing to a cow's inability to rise. Early diagnosis and aggressive treatment are key to managing these infections. Diagnosing the underlying cause of a downer cow is not always straightforward, but it is essential to develop an effective treatment plan. Start with a thorough checkup. Observe the cow's behavior, overall condition, and mobility. Any signs of injury, swelling, or trauma should be noted. Blood tests will help identify metabolic issues, such as calcium or magnesium deficiencies. X-rays or ultrasound may be necessary to rule out fractures or internal injuries. If you suspect nerve damage or central nervous system involvement, a veterinary surgeon will conduct further tests to pinpoint the issue. Once a diagnosis is made, the next step is to treat the underlying cause and provide supportive care. For metabolic imbalances like milk fever, administer intravenous calcium solutions. This can quickly reverse the symptoms and allow the cow to stand again. Oral or injectable magnesium or phosphorus supplements can restore balance and encourage the cow to get back up. For fractures or severe trauma, pain management is crucial. In some cases, surgical intervention or specialized bandaging might be required. If an infection like mastitis or metritis is the cause, prompt administration of antibiotics and anti-inflammatory drugs can help the cow recover. Keep the cow in a clean, dry, and comfortable area to prevent pressure sores and further complications. While treating downer cows is vital, prevention should always be a priority. Regular monitoring of cow health, proper nutrition, and good farm management practices can reduce the risk of downer cows. Supplementing your herd with the necessary minerals and ensuring safe calving conditions can go a long way in preventing metabolic disorders and injuries. Downer cows are a serious concern for any dairy farmer, but with prompt diagnosis and treatment, many cows can recover and return to full health. It's about acting swiftly, understanding the causes, and providing the right care. By keeping a close eye on your cow's health, maintaining their nutritional balance, and preventing injuries, you can reduce the likelihood of facing this distressing situation in the future. Remember, every cow counts, and with the right knowledge and tools, you can help them stand tall again.